It's almost time for you to deliver your baby, and we're so happy that you've chosen Ochsner Baptist as the place to give birth. Well, you can feel very confident in where you're giving birth because at Baptist, we're a level 4 facility for both mamas and babies. And that means we take care of the sickest of the sick pregnant patients as well as neonates. And so we're well prepared for any emergency. Our goal is to give you the birth experience that you want, but balanced with safety. So our doctors and our midwives are here to offer you pain relief options like epidurals, pain medicine, even laughing gas. Or some moms choose non-medicated births using natural childbirth techniques such as breathing, relaxation, or even hydrotherapy in our wonderful tubs or showers. You decide what's best for you. We recommend that you learn about giving birth and how to take care of a baby before you deliver. So we offer a wide variety of classes for our parents to help prepare them for labor and delivery, taking care of that newborn. We even have classes for grandparents and siblings. You can find that class schedule on ochsner.org/newmom. Now, in your clinic visits, we'll be sharing with you some breastfeeding videos. And this way you have the information you need to help you decide which feeding method works best for you and your family. If you want the routine care we provide for most patients, a birth plan isn't necessary. But if you have some special wishes for your birth experience you would like, you're welcome to have a birth plan. Now, we do have a birth plan form we would like you to use, and that's found on ochsner.org/newmom. Fill it out and bring it to a clinic visit with your doctor or your midwife before 34 weeks so they can discuss and review it with you. Tell your nurse about it when you're admitted here at the hospital. Now, while our goal is to give you that birth experience that you want, occasionally it has to be adjusted for the safety of you and your baby. If you're not scheduled for a C-section or an induction, we do want you to call the hospital before you come. That number is 504-842-3595. You're going to be admitted to the hospital for one of 3 reasons. Number 1, you are in active labor, or close to it. And close to it is about 4 centimeters in a good contraction pattern. Number 2, your water broke. That's also called ruptured membranes. Or number 3, if there's a concern with something like your blood pressure, bleeding, or maybe there's an issue with the baby. You time the frequency of contractions from the start of one contraction to the start of another contraction. And when you're contracting every 5 minutes for an hour or 2, we want you to give us a call, unless your doctor or midwife has told you something differently. Now, when you come to the hospital, we're going to check you out in the OB emergency room. That's on the 6th floor next to labor and delivery. And that's where we will decide whether you'll be admitted. Park in the Jenna Garage, located on Jenna Street, and go to the 2nd floor so you can take the pedestrian bridge to the hospital located in the Clara building. Take the elevator to the 6th floor and go to the labor and delivery waiting room where you can check in with the receptionist. Having a baby takes time with inductions and scheduled deliveries. We recommend that you call your family and friends when the baby's birth is approaching, instead of bringing everyone with you when you're admitted. We want you to concentrate on getting rest because having a baby is exhausting work. Here are a few items you may want to bring to the hospital. Music, aromatherapy diffuser, pillows, phone chargers, camera, peanut ball if you're getting an epidural, birthing ball if you're not getting an epidural, a tablet to download the MyChart app, robe and slippers, change of clothes, toiletries and makeup, baby pajamas that cover the legs, and a properly installed car seat. Go to one of the free inspection stations around town to ensure that your car seat has been installed correctly. A list of locations can be found on ochsner.org/newmom under post-delivery resources. Bring in only items you'll need in delivery when you first arrive. Things like pillows, phone chargers, birthing balls, peanut balls, things like that. Then after you get settled in your mother-baby room, then you can bring in all of the rest. While you're in labor, you're allowed to have visitors if you want them. Just remind them that they need to bring their ID and stop at that visitor station in order to get their badge. Now, there are some times when visitors are restricted, like when you get an epidural. Well, that's a sterile procedure, so we ask all visitors, including your partner, to go to the waiting room until it's completed. And we can't allow them for safety reasons to stay in the hallway. Now, when it comes time to start pushing, you're only allowed 2 guests in your delivery room. Now, when it's time to have the baby, lots of hospital staff will be coming in. You'll have lots of nurses and doctors, a surgical tech. During the delivery, you're not allowed to photograph or take videos, but that's fine right after the baby's born. And your guests can return after the baby's born once you're settled and ready. After your baby's born, if there are no complications, we immediately give you your baby so you can give your baby a big hug. We're going to dry off the baby and cover you both up while you're doing skin to skin. Skin to skin is when we place that little naked baby on your bare chest. This warms and calms the baby, it stabilizes the heart rate and the breathing, and it even makes breastfeeding easier. We will do uninterrupted skin to skin until the first breastfeeding is completed, or if you're formula feeding, for 1 hour. And unless there are complications, we are never separating you from your baby. If you will be scheduled for a C-section, there are a couple of things you need to keep in mind. Number 1, do not eat or drink anything 8 hours before your surgery. Number 2, the night before, take a shower, washing your hair first and then your body. And then number 3, do not shave your pubic hair. Shaving can cause microscopic nicks in the skin, which can increase your risk for an infection. You are allowed to have one support person accompany you into the operating room. Coveralls, mask, hat, and shoe covers must be worn by your support person to help maintain sterility. If you want to do skin to skin in the operating room, just ask your nurse. But if you're not feeling up to it, well, we'll take your partner and your new baby back to the recovery room. Now, your partner can do skin to skin if they would like, until you return. And once you get back to the recovery room, well, you're going to be doing skin to skin until the first breastfeeding is over, or if you're formula feeding, for 1 hour. Now, those recovery rooms are small, so your guests are limited to 2 at a time. After your recovery on the labor and delivery unit, we'll move you to our mother-baby unit, where you can get some needed rest. Now, mornings are very, very busy with lots of doctors and nurses coming in to check on you guys. That's why every afternoon we built in quiet time. That's a chance for the family to get some needed rest. It's from 2 to 4 every afternoon. Remind your friends and family about quiet time so you won't be disturbed while you're napping. Now, visiting hours end on mother-baby unit at about 9 o'clock so you can settle down into some sort of routine. You are allowed to have one person spend the night with you as long as they're over 18 years of age. Children are not allowed after 9 o'clock and during quiet time from 2 to 4. Our pharmacy will visit you to see if you want to fill any prescriptions or purchase any items like diapers, diaper wipes, breast pads, things like that. And we even have a photographer who will offer to take beautiful professional photos of your newborn baby. 42 weeks, you were sent a message in your My Ochsner about the birth certificate. We recommend that you start filling it out now and have it completed before you get to the hospital. Both parents have to bring a valid ID. And if you have any special circumstances or you have any questions, feel free to call the birth certificate office at 504-842-2885. Your baby's birth is fast approaching, and we're excited to help you prepare for this incredible experience. Look for more videos coming to you soon, and remember to bring your tablet so you can download the MyChart app to assist in your care. We are honored that you have chosen Ochsner Baptist as the place to welcome your new baby. We'll see you soon.